Everyone, good evening and welcome to our webinar today. Thank you so much for tuning in. We are going to have the Women's Health Talk, and my name's Elizabeth Riwa, Dr. Elizabeth Riwa, and I'm going to be your host today. Very excited to have this special talk with you because this is an area that touches me very near to my heart. And I don't know where you're hearing me from. You can just type in the chats below. Like we are hearing me from whatever city, whatever country. I know we have people from South Africa, we have people from Zambia. I'm excited to have you here. I'm sure it's going to be a very informative and educative 1 hour talk. And if you have any question as we go along, something that you want to note down so that you can ask in the future when we are done, please note it down so that we are ready to start. And as we are going to learn, I'm sure you'll learn something new. So I hope you will write it somewhere, because we say you cannot apply something which you don't remember. So don't trust your memory. Make sure you have your notebook in hand. If there's a friend you need to remind to get in the meeting, please do that now so that we start immediately. We have a lot to share and I'm excited to have you. Like I said, my name's Elizabeth Riwa and I have a background in medicine, but for the past 10 years, I've been helping people look better and feel better under the umbrella of this amazing company. And one thing that drew me first to the company was the money. But the second biggest impact that I got from partnering with this company is the health part, which you cannot put a price on health. And I'm sure we're all here because we want to know more about how we can improve, we can better, not just our personal health, but the health of other women that are around in our societies. Because one thing that I know is health is your first immediate wealth. And having a background in medicine, I know in our medical field, in our medical area, we are taught to handle diseases when they come. It's about waiting for when a disease comes and then you get a drug, a treatment that will go handle the disease. We are not so much taught about nutrition, about what we can do way before the disease comes in our bodies, or even the impact of nutrition on our health. So after so much research and my own personal experience, I've come to realize that there's a lot of influence that nutrition can have on our health. Personally, I had a lot of challenges. I'll share with you more about them with my own personal health. I faced hormonal imbalance. I faced polycystic ovarian syndrome. We'll talk about that more. I faced infertility for quite some time after 4 years being in marriage. So I learned a lot during that period. I learned a lot through my own personal experience, and that is what I'm here to share with you. So I believe you are here ready to learn with two open ears, because I believe one is for you to take action on your own personal health, but also someone else who is not in this talk. You can influence them by the information that you get from this talk. So we're going to talk about a lot of things, about a variety of challenges that are facing women today. And those challenges are from the moment a woman becomes a woman, I say that is the period of puberty, to the moment someone leaves this world, even the menopause areas and all those issues. So we'll talk about a lot from hormonal imbalance issues, our sexuality and our sexual health. That is an area that is not even talked much about. We are assuming like everybody just know what to do or how to do it. But also we have issues like endometriosis, infertility, tumors and cysts. Women have a lot of tumors that can happen in our female reproductive systems and all that can affect our health tremendously. We also have something called PID, which we'll discuss, and then menopause, and the most important, anti-aging, because I believe you're like me, you still want to look good, to feel good for a lot of more years from now. So what can we do to touch those areas? What can we do to handle all these challenges? And probably to get a glimpse of understanding, because they say you cannot improve that which you don't know. So we have to know what are the challenges, what are the issues that are facing us today. So from puberty area and the time when we get to our monthly periods, there are things that can be challenges, but just because you've been used to that idea, you've been used to the way that things are, then you may not look at it as a challenge. You may be facing something like we call unending acne, something that happens to a lot of people during puberty, and sometimes it can continue because of the hormonal imbalances that could happen around that period. You could be facing painful periods, and probably ever since you got your first period, you have been experiencing the same painful periods, but things are not supposed to be like that. It's just a deficiency in your body that is causing something like that to happen. And also, how are your periods? How are the periods? Are they regular from the very beginning, or they are irregular? And irregularity in periods is not just having too much period. Sometimes you are getting too little period. Sometimes it goes on for a lot more days than it's supposed to. Sometimes it gets painful, like I showed you earlier there. So all these things are challenges which are to be tackled. But again, we call this PMS. It's the syndrome or a set of symptoms that can happen around that period of getting a period. And they could range from mood imbalances. You could be feeling some headache, fatigue, you feel tired most of the time, just around that period, just before your menses. And sometimes you may fail even to continue with your work or to continue with your life normally. Again, it's not supposed to be like that. So another issue facing a lot of women, especially around teenage areas or people who live in shared communities, is recurrent urinary tract infections. They are very easy or common in women, even so much more than for men. And there are things that influence that, which we'll also talk about, and what we can do actually to help our bodies tackle these challenges a bit more. Another very important thing to talk about, like I said, it's our sexual health. How is your sexual health? Are you enjoying that process? Are you enjoying being a woman and enjoying that sexual intercourse? Because that is the thing that is most commonly looked at as something for men, or something to be mostly enjoyed by men. But women, it's most of the cases different. Most of women complain that they lack interest in sex. They lack interest in sex, sometimes during certain seasons in their lives, and for some, even all the time. Sometimes during pregnancy, your hormones may change and you may lack that interest. You may not feel like that. Even after having a baby, sometimes most women do go through that season, or probably you have a lot of stress going on around you and you lose that interest. And if you don't have that interest, it means you'll be just doing it for the sake of doing it and saving your marriage probably. But that is not supposed to be the case, because I believe God put that activity for both of us to enjoy, not just the men, but even the women. Also, sometimes it's not enjoyable because of our state of our vagina. If the vagina area is too dry, which can be because of a lot of hormonal issues, imbalances, and the way that we eat and all that, it means you won't enjoy sex, because it will tend to be painful while you're doing intercourse. Because when it is dry, it means that it will be forceful, and sometimes it could even lead to bleeding after the intercourse. Sometimes painful intercourse could be a result of a certain tumor or cyst or any inflammation that could be happening around your reproductive system, which of course will also see what we can do about it. And sometimes you could tend to be difficult to be aroused, and that could be related to your emotional health, because they say sex starts in the brain. The state of your brain will determine the way you enjoy or not enjoy the activity. And a lot of issues, women go through a lot of issues, just in family, in work, in business, in a lot of things. So you could be facing a lot of stress that will affect your sexual health as well. There's a solution for that. There's things we can do. But there are also drugs which cause those sexual challenges. There are drugs which cause vaginal dryness. So it means when you're on those drugs, you'll need something to help so that you can overcome that dryness. Or it could be a disease, or it could be just menopause period or pregnancy or any other thing like that. So those are the main challenges. Sometimes you could look at yourself and be surprised. Why am I not enjoying? Why don't I have that feeling? Probably you're just liking a vitamin or a certain natural thing in your body that is supposed to give you that feeling. And if it's not there, you won't have that feeling. And you'll think that it's a normal thing, but actually it is not. And there's something you can do about it, because the goal is you enjoy your womanhood. You enjoy everything about your sexuality. And another very big challenge, which you cannot go any further without talking about, is hormonal imbalance. It's a very common challenge affecting a lot of women. Some women, they don't even know they're facing hormonal imbalance. You could think, why am I feeling happy and all of a sudden I feel sad? I don't understand my feelings. It could be probably because of the hormonal imbalance, because one of the symptoms it causes is mood swings. You could be changing your mood every now and then. You could have very low libido. You don't have interest in sex. You don't have that the sense of interest and all that. Could be because of the hormonal imbalances, which is a very common challenge in women. Some headaches, especially the headaches that go around your eye area, they could be caused by hormonal imbalance. This is something that can easily go undiagnosed because we hardly go to the hospital and say, please check my hormones. And I could say hormones are like a cake recipe. When you're making a cake, if you just miss a single item, we're talking about in half a teaspoon amount, and you just double it by accident, everything will go not in order. Everything will go different. You will not have a good end result. The same in our bodies. If our hormones just go in a very minimal imbalance, you could have a whole different range of symptoms. You could be sweating at night. You can't sleep without an AC on or a fan on because of those night sweats. You could be craving a lot of sugars, a lot of fatty foods. That could be just a symptom of hormonal imbalance. And ending acne, lack of sleep, tiredness all the time, and weight gain. Very easy to gain weight. You see a lot of women, for a lot of women, it's very easy to gain weight. You like just eat a piece of bread and then you're like 1 kilo more than you were. Why? The hormonal imbalance inside could be the cause of the way that you are easily able to gain weight. So you could say, for some people, for a lot of women, they can say, what could be the cause? What is the cause? Why should I get hormonal imbalance? There's a lot of things that could be the reasons. And the first most important of them all is what we eat or what we don't eat. Our diets, I can say, are the main causative agent for this thing. And what do I mean by our diet? Because we eat a lot of processed foods. If you just look at yourself last week and the last shopping that you did to a supermarket, how much of it was processed food? For our current lifestyles, it's a lot of it. Sugars, how much sugar do you eat? We eat a lot of sugar in our diets. We take a lot of alcohol probably, or a lot of caffeine in our diets that have a detrimental effect in our hormones balance. But again, what don't we eat? We don't eat enough vegetables. We don't eat enough fruits. They say we are made from sand. We are made from grass, and we are supposed to eat more things that are coming from the ground. We are made from the ground, and we'll go back there when we die. So we are supposed to eat more of the foods that are coming out of the ground. But most of the time, we eat the totally different things that most of them are just processed in industries and all that. But again, what do we apply in our bodies? Because from the skin to your blood supply, it only takes 26 seconds. It's a very quick process. So look at your dressing table. What does it look like? Does it have a lot of chemicals? And sometimes we don't read labels. So all those things we're applying on our bodies, they end up on our blood supplies. They could be causing a lot of hormonal imbalances. The things we apply, the things we use, even to clean our houses, all of those things, they have a very detrimental effect. And let me not talk about the makeup, because if you apply some lipstick in the morning and in the evening you go back home, it's not there. Where did it go? Straight to in your mouth and into your bloodstream. So what does that mean? It means we should look at everything around us, because everything is relating to each other. And all of those things that we put in our bodies, from our mouth, from our skin, the things we breathe in and all that, they cause the toxic overload in our bodies. And if we don't treat the overload, again, it will lead to hormonal imbalance. And some certain period in our lives, they can be causative agent for hormonal imbalance, like menopause. When you're breastfeeding, your hormones can change. When you're pregnant, your hormones can change, and they can cause all those symptoms that we talked about. But also some drugs, they could cause an imbalance in your hormones, diseases, the thyroid diseases, and even some diabetes could cause that as well. Also, overweight and obesity is one of the biggest causes of hormonal imbalance. They go hand in hand. Overweight and obesity causes hormonal imbalance, and also hormonal imbalance causes overweight and obesity. So that is like a vicious cycle that keeps getting you deeper and deeper into challenges. And the last but not the least is stress. So our health is not just our bodies, it's also our minds, our mindset, and the way that we treat our minds. Because if we get rid of stress, be able to handle stress, even the hormonal imbalance can be corrected. So all these things are things that we should look at. And one thing that you should not ignore is hormonal imbalance. Because sometimes you may say, I'll just handle the symptoms, it's okay. But I came across this research, which I just have to share with you. You know, breast cancer is one of the biggest killers of women in our generation today. It's the biggest cancer affecting women. And they say, these are the percentages of risk for breast cancer for women. So you could look at environmental factors and be very afraid of them and stay far away from them. But they contribute about 80% of your breast cancer risk. Genetic, it means probably your mother or your grandmother had breast cancer. That only contributes to about 20% of your breast cancer risk. But your estrogen balance, your hormonal imbalance, it contributes about 97%. It's close to 100% of your breast cancer risk. So if you just control your hormones, if you just control your weight, because fat cells are estrogen making machines. So if you have a lot of fat in your bodies, you're overweight, you're obese, it means you're also causing the hormonal imbalance. You are also causing too much estrogen in your body. And that too much estrogen is a very big risk factor for you getting breast cancer. Even if there is no one in your genetic predisposition who has breast cancer in your family, or even you're not exposed environmentally with the other factors. So my dears, we should not ignore that. And that is why we should know what can we do to control hormones naturally. Vitamin D is known to be a very special one to help your body balance the hormones. And that is why it's a very vital supplement. You can ask yourself, am I getting enough vitamin D? Then you need to supplement for it. Omega-3 fatty acid, very important. Maca, very important. But also we have just tea berry, coconut oil, which you can take in your bodies. And this has to be the extra virgin, the very, we call it the extra virgin coconut oil, which is not very naturally made. It's the one that you should use. But also exercising, but not too much exercising. Just normal exercises 3 to 5 times a week will help you with that. So that is one of the biggest challenges that women face. But again, we have fibroids. I'm sure wherever you're hearing me from, you know someone who has fibroid or who had fibroids. And this is a very common thing for women. Actually, 70 to 80% of women will get fibroids before they're 50. So the ratio is very, very high. The risk is very, very high. Why? Our lifestyles. How do we eat? How do we supplement? How do we exercise? All these things, they are risk factors for us to get issues like this. So fibroids is a very common thing, and it's just we call them tumors that could happen in your uterus, and they could be of varying sizes. You could have a tiny one and it could grow to even a size of a baby. And when it grows, those are the times that it gets to be very cumbersome for your health. It could cause a lot of vaginal bleeding, irregular periods, too much bleeding during your periods. It could be painful, and it could even cause you not to get pregnant or not to be able to carry a pregnancy because of those fibroids. And it's something that usually happens after a person is over 30 years old. But now that was in books. But currently we have people having fibroids even at 18 years of age. There is someone I know who went to the hospital because of fibroids, and she met a lady who was 18 years old and was scheduled for an operation to remove their uterus. Why? Because there was too much fibroids in that lady's, young girl's uterus, so they had to remove the whole uterus. Imagine, we have a lot of people who are going through these challenges, who have to go through operations, and some who have to even lose their uterus because of these challenges. And one thing we need to know is we have to go to the root cause, because in the hospital, they'll just take out the fibroid, but they'll not take out the root cause. What is the thing that is causing those tumors? And that is the talk about today. We're going to talk about those causes and what we can do so that we can run away from those causes. But we also have cysts that usually happen in the ovaries. And the cysts are just, we call them fluid-filled sacs that could appear in your ovaries. A normal ovary looks like this. But an ovary with a cyst, it will be bigger. It will have something like a sac which has fluid inside. Now that could also be painful. It could cause someone to have pain on one side, usually if it's on one side. But again, it could cause someone to not be able to be pregnant. Again, it's another big complication of ovarian cysts. But it could also twist. It could cause very severe emergency that could take you to an operation room. So it's not something to ignore as well. If you have a cyst, it's not something to ignore. And most common causes of these things are, first of all, hormonal imbalances. But also we have endometriosis, which is a challenge where the uterine wall grows outside the uterus. So it means you have the uterine wall that is supposed to be inside the uterus, but it could grow in the ovary area. And if it grows there, it causes a cyst or a tumor that we call endometrioma that could cause ovarian cyst as well. And it will be very, very painful as well. So pregnancy period is also a time where you can get ovarian cyst, but these will usually disappear after the pregnancy period is over. If they remain, it means there was another cause. It was not just the pregnancy. And also infections. You could have severe infections that go untreated for a long time. They could cause also a cyst. Menopause could also be a causative agent for cysts happening in your body. So what are the things that you could be feeling if you have a cyst? You could be having pain. pelvic pain that could happen at any time, or could also happen during intercourse. And you could also have pain during bowel movements, because there is something that is blocking that normal bowel movement to be going. So it could be very painful during a movement, and you could even feel bloating in your body. You feel like your tummy is just too heavy and filled all the time. And you could be going to the toilet more frequently than you used to. Why? Because the cyst is pushing on the bladder, and it causes that. It could also cause breast tenderness. If you have that tenderness and it's not during your periods, during any other time, it could mean you have a cyst. And any vaginal discharge that is not during your period could also be a sign that you have a cyst in your body. Yeah, so those are the things that we should not take for granted. If you have any of these symptoms, don't just say, I'll get over it, it will go away. No, it means you have to go to the doctor and check yourself, do an ultrasound, and it will show if it's a cyst or it's not a cyst or any other thing that is there. So another kind of a cyst, this is something that is so personal to me, because I was diagnosed with polycystic ovarian syndrome, that is what we call PCOS, when I was in my third year of medical school. So the doctor told me I have PCOS when I went to him, because I had very severe irregularities in my periods. I used to have periods sometimes for 2 consecutive weeks, not days, weeks. Sometimes even 3 weeks I would have period every single day, and they used to be extremely irregular. Today it could be just a few drops, and tomorrow I'll have a very wet pad after just half an hour. So that used to be the normal for me, and I used to think, what is the problem? What is the cause? Sometimes I never used to get a period for up to 6 months. There is no period at all. So that used to be my case, my very severe irregularities. So when I went to be checked, I did an ultrasound, and they saw very typical PCOS. And I'll tell you more what PCOS is, but it's something that is very common for women. And for most women, it goes unnoticed. 50% of women who have polycystic ovarian syndrome, they don't even know they have it. They could have some of these symptoms, and you don't have to have all of them. You could have irregular periods. You could have excess facial hair. I didn't really have excess facial hair, but still I had very typical polycystic ovarian syndromes. So you could have small cysts in the ovary, and when you do an ultrasound, these will be clearly seen, and it could be very easy for you to gain weight. And one of the biggest thing that happens for someone with PCOS is infertility. It will be very hard for you to get pregnant. Why? Because when we talk of polycystic ovarian syndrome, we mean this. In a normal ovary, every month a lady produces an egg, and that happens when there's something that we call corpus luteum. It starts to grow, and that is like, we call them the pre-cycle of an egg. When it grows, and then it becomes a follicle, and then it grows, it matures. After it matures, it means it releases an egg, and that is what we call ovulation. You get an ovulation, and then when that egg meets with the female sperm, with the male sperm, they produce a pregnancy. So if someone has polycystic ovarian syndrome, it means there is a change in your hormones balance, and your follicles will never reach maturity. They will grow, and then they'll reach a stage, they will stop there. And if they stop growing, it means they will leave cysts in your ovary. So when you look at an ultrasound, it would have small cysts like this. They're not painful. I never used to have pain. I never used to have even painful periods. They used to be very painless. So this could be the typical symptom for someone with that. And the simple presentation that will happen is you won't be able to get pregnant. Infertility is PCOS is one of the biggest causes of infertility in women, because you're not ovulating. There is no pregnancy if there's no ovulation. And you could have normal period, and that is something that most women don't know. You could have normal period, but also you could be not ovulating, because you don't need an egg to come out for you to ovulate. You just need your hormones to be able to increase your uterine wall so that you get your period, okay? But you could get an ovulatory period, we call them. And that is something that happens a lot for someone with polycystic ovarian syndrome. So if you go to the hospital, they'll tell you, if you're looking for a baby, if you're not looking for a baby, then just go home, wait for when you're trying to conceive, then we'll come and handle. We'll come give you drugs to help you with that. But again, even if you're not looking to get pregnant and you have PCOS, probably you're diagnosed or you think you have PCOS, it's important to start tackling it now, because that means you have severe hormonal imbalance. If it does not go handled, it means it could cause a lot of issues in the future as well. But also something that I was given as well when I went to the doctor around that time was birth control pills, because they will help control your hormones. They'll help regularize your periods. But again, those birth control pills come with their own set of side effects. And again, you're not handling the root cause of the problem. So the most beneficial way to handle that is to go to the root cause and handle it that way. And another thing we are told is lose weight, handle your weight. But again, just having PCOS is a risk factor for you to be able to gain weight easily. So it becomes a very difficult battle to go across or to handle if you have that thing. So what can we do? Or what is the solution about that? So when you talk of birth control pills, they also come with a lot of side effects. And this, I'm talking about someone probably using it as a drug or someone using it as a way of birth control. You have to be aware of what are the side effects also, so that you make your informed decision about what choices do I make. Because just using those birth control pills will cause nutritional deficiency. So it means it's very important for you to be on supplements, because you have to replace that which is lost because you're using your pills. And also it could cause severe vaginal infections, especially fungal infections, which are very common to women as well. You get a whitish discharge in your vagina that could be very itchy, and it could be very uncomfortable as well. It could cause moodiness. It could increase your cancer risk. It could also increase your risk for blood clots. So those are some of the side effects that are around the birth control pills. Again, make your informed decision, because you know what are the choices that you have at that particular point. Another very big important thing that I want to talk about is PID, pelvic inflammatory disease. It's a very common issue for women. And what is that? It's just an infection that affects your uterus, your female reproductive system. And this usually is a result of having an infection in your vagina. Probably it's a sexually transmitted infection or any infection that is not treated here. And then slowly it could grow and go inside your uterus. It could even go to your fallopian tubes and to your ovaries and affect it there. So this is a result of untreated infection. So it's very important to make sure you treat and you finish your dosage of any infection that you have. Because if it goes untreated and it leads to PID, it's a very difficult thing to handle, because it could cause pus to be around all these areas of your female reproductive system. And it could cause severe implication or severe complications like blockage of your fallopian tubes. Or sometimes it could cause infertility, because your ovaries cannot function, or your ovaries cannot pass the egg in the way that it's supposed to. So those are issues that are around PID. And someone who has PID could be facing some of these symptoms. It could be pain in your abdomen, in your pelvic area, pain during intercourse, back pain, all of those pains that are unending. They're chronic kind of pains that you usually have them. You always have them. They could be a sign that you have PID. And how is your vaginal discharge? Because if you have yellowish, greenish discharge with a bad smell, that could be a very big sign that you have PID. Irregular periods, you have a bit of fever that comes and goes all the time, fatigue, painful urination. All these symptoms could be mild or severe, just depending on the extent of your challenge. So it's not important. It's not good for you to ignore any of these symptoms, because they could mean that you have PID. And if it goes untreated, it could lead to infertility, even the blockage, because of the blockage of the fallopian tubes. So we have to, before we go any further, let's talk a bit about our vaginal discharge, so that we know what is normal and what is not normal. If you have clear discharge, which is just colorless, I can say, and it's probably the color of your normal flu, like you can say the runny nose. If you have a runny nose, that color and that consistency and that stickiness, that is a normal kind of a discharge, and could be changing in consistency throughout the menstrual cycle, because your vaginal discharge should change consistency. It should not remain the same throughout your period, throughout your month. So if it's not changing, again, it could be a sign that you're not producing the right vaginal discharge in your vagina. So there is something that needs to be done about that. If it changes consistency, if it is yellow, green, or gray, or it's the color of milk, what we call that, the milk that has gone bad, I can say. If it's that color and that consistency, like coated cheese, it could mean you have a fungal infection as well. If it is smelly, it means there is something there. If it is blood stained and you're not on a period, it means there is something wrong about it. So we have to be careful about taking note of that, so that we can be able to track something before it is too late. anything that is a change in our vaginal discharge. And also, before we go any further, I'll talk about this challenge, endometriosis, which is a very common challenge. The main challenge that it causes is pain. The main symptom of endometriosis is pain. And what is endometriosis? Like I said, the vaginal wall grows outside the uterus. I mean, the uterine wall grows anywhere outside the uterus. It could be on the outer wall of the uterus. It could be on the fallopian tubes or in the ovaries. And it will be very painful. Your periods will be very painful. It will be hard for you to conceive. We have a lot of issues, people facing infertility because of endometriosis. And what could be the causes? Nutrition is one big one. Toxic exposure, lifestyle. They play a very big role in someone getting endometriosis. So all these issues are handled first from the nutrition part. And we have some key supplements, some key nutrition that are important for someone with endometriosis. B vitamins are very vital because, again, they help your body detox, cleanse, remove toxins from your body. And they're also anti-inflammatory because for someone with endometriosis, you have severe inflammation in your uterus, in your reproductive system. And that is what will cause a lot of pain during periods, during intercourse and all that. So we have to have B vitamins because they will help a lot in handling that pain and that inflammation. Magnesium also is very important to relax your muscles and to relieve that pain as well. So it's important to have that in your nutrients. It's important to have a lot of omega-3 because that plays a big impact in controlling your hormones and also inflammation, to control that inflammation that could be happening in your uterus area, in your reproductive system. But also probiotic. Probiotic are also very good for someone with recurrent UTI. Because when you you give our body the right bacteria, it will help a lot to handle any other bacteria that are affecting your body, any other bad bacteria that are taking charge in your bodies. So that is something about the endometriosis that we talked about. Again, we have a lot of challenges happening for women. One of them that I personally faced for 4 years in my marriage is infertility. For someone who is under 35 years old, if you have unprotected intercourse for 6 months and you don't get pregnant, that could be a sign you're infertile, because you're supposed to get pregnant if you're having intercourse without any period, regular intercourse. 1 in 6 couples are diagnosed with infertility. It's a very common issue and it's affecting both men and women. It's not just for women, but for women, there could be a lot of causes. There could be no symptoms at all. You could be having your periods. Again, like I said, you could have periods, normal periods, but still you do not have ovulation in those periods. So you could be infertile even if you're having periods. But the other things that you could see is hormonal imbalance. Probably there's a blockage in your tubes, or you don't have enough follicles coming from your ovaries. All those are issues that are affecting someone to be able to be infertile, causing someone to be infertile. Also, for hormonal imbalance causes, we see PCOS as one of the big ones, obesity, one of the big ones. And that is why for someone who is wanting to get pregnant, one of the biggest things you can do is to lose weight. Lose 10% of your weight and increase your fertility chances by a big percent. But we see all those things, and it's important to track yourself, to track your ovulation, to track your, like I said, there's changes that are going to happen, that are supposed to happen in your vaginal discharge. So if you don't see those changes, if you don't see those changes in your monthly cycle, it means you could be not ovulating. And what can you do to change that? What can you do to work through infertility? The first most important is lifestyle change. You have to change how you eat, what you put in your bodies. You have to change to take in some important and focused nutrition. I'm talking about vitamins and minerals and herbal supplements that are probably important directly for your situation before you even reach the stage to go to the hospital and get those surgical procedures or those medical procedures. So for 4 years in my marriage, I faced infertility, and the doctor told me that I need to take some medications, and I took them for about 6 months, but I did not see any change in my cycles. I did not see any change in my getting pregnant. But when I researched about nutrition and I learned more about what I need to do to help my body naturally heal, and I started to do that. I changed my diet. I started using the right nutrition, and I'll share with you what nutrition that I used. I got tremendous changes, and it did not take 6 months. Around the third month of using these supplements, actually it was the 2.5 months, I got tremendous changes. For the first time in my life, I got 4 days period, which I've continued to get until today. And for the first time in my life, I started noticing those changes in vaginal mucus. Before that, I never used to get that. And that was the reason why I never used to get pregnant. But eventually, the third month of doing that, I was able to conceive. And now I'm a mother of 2 boys. The second boy, I did not have to go through the same challenges, because when you use nutrition, when you focus on the right nutrition, your body heals and you don't have to go back to the challenge that you had below. So we'll continue sharing about that as we go along. But another big challenge we cannot overlook is overweight and obesity. And this for women is a big one, because it could happen after your pregnancy. We put on a lot of weight, and sometimes it's very difficult to go back to your health. And sometimes you think it's impossible, so you relax where you are. But again, look at overweight and obesity, not from your looks part, not from your looks perspective, because you can look good in any weight. But what about your health? When you have obesity and you maintain overweight and obesity, you open the route for diabetes, you open the way for high blood pressure, stroke, high cholesterol, even cancers. You know, there was a time when we read books, it tells you smoking is the biggest risk factor for cancer. But today, overweight, it beats smoking. So you'd rather smoke than be overweight. Imagine, think about that. So we should not tolerate overweight and obesity. No matter what is the cause of your overweight and obesity, you can go away from it. You can run away from it, because I did that. So I know you can do that. And the other big challenge or situation happening for women is menopause. That usually happens around 51 years of age, but it could happen up to 8 years before that, even 10 years. We have people just over 40 years who are starting to get menopause, and we call that premenopausal period. And it could be associated with a lot of issues that could be influencing your quality of life. We want to enjoy our life. We don't want to be handling all these issues, irregular periods, hot flashes. We cannot be in a place where we could probably be in public in a normal temperature place, but you're feeling hot from the inside, fired up. Your mood swings, vaginal dryness, libido is not there at all. All these are issues that could be facing you even from 40 years of age. So this we call early menopause. And again, it shouldn't be ignored, because vaginal dryness, we see it's one of the biggest issues that happens, and it causes a lot of discomfort. You won't enjoy your intercourse. You won't enjoy even your periods, just a normal life. It won't be pleasurable because it will be itchy. Your vagina will be very itchy, and it could even lead to other complications. So it's an important thing to control. It's an important thing to even prevent by eating a healthy diet, having omega-3, plenty omega-3 in our diet, and also having regular intercourse is something that helps you prevent that, because if you don't lubricate it frequently, it means it will easily go dry. But when you get that challenge, you have a way to treat it by using supplements, by using the right nutrition in your diet to be able to go about it. If you have it as well, you can use Aloe Vera Gel as a lubricant, or as something that will reduce the itchiness and the discomfort that is associated with vaginal dryness. So those are the things that a menopausal person or a perimenopausal person could be facing. But we see one of the remedies that are recommended is to eat to eat the right foods, to drink enough water, to have your supplements, have your natural herbs. Also, maintain a good hormonal balance. And all these things will help you handle that period so that you enjoy that perimenopausal period and you not have a lot of stress going through that period. So again, I will go back to these words, that the first wealth we can ever have is health. So we cannot run away from the fact that we have to be aware of what can we do on our part, not waiting to go to the hospital, not waiting for when I fall sick. Even if you have none of the challenges I've talked about, you still have to invest in your health. You still have to do something, because we are all exposed. We are all at risk of all the challenges that I've talked about. I faced some of them, and I'm sure you are facing, or you probably face some of them, Pia. And also you have a way of helping your body heal and recover from whatever that you're going through. But we know health is multidimensional. Health involves your exercising regularly, eating healthy, drinking a lot of water, and working on your mind and your stress, reducing a lot of stress, from your surrounding. When you do all these things together, you will have a healthy life. You will enjoy your life as a lady, no matter the season that you're going through. So the main challenges that are affecting our health, you could group them into two. They're basically lack of proper nutrition. We don't eat enough. We don't eat enough of the right things that we should be eating. And another thing is toxic overload and the free radical damage that comes because of the toxic overload. Let's talk about this one by one. The first most important one we should talk about is the free radicals. And you could say, what is a free radical? Free radicals are things that our bodies naturally produce, and some of them we put from outside into our bodies. And these are unstable molecules that are lacking one electron, like you see this red thing that is seen in the middle here. So if it's lacking an electron, it means it will go to your normal cell, to your normal molecule in your bodies, and it will want to take it away. It will want to take that electron that is missing. And if it does this, it means it will destroy this healthy cell. And that is the thing that causes a lot of issues in our bodies. Now, when we talk about antioxidants, what is an antioxidant? You could be hearing a lot about that, but you don't know what that does that mean. An antioxidant is another element that has an extra electron. So when it gets in your body, it goes to your free radicals and it gives them the lacking electron that it's looking for, preventing it from taking it from a healthy cell and destroying your body. So when we talk about free radicals, they're the things that are causing our bodies to age, especially premature aging. We will all age, but you should not look 60 when you're 30, or your body should not feel inside like you're 60 while you're just 35. So this premature aging, or the diseases that we could have, they are a big result of the free radical damage that is happening in our bodies. The same way that you can cut open an apple and just expose it to air, and it will start turning color. It will start turning gray, like you see, brownish, like you see in the picture. That is exactly what happens in our bodies if we don't give our bodies the antioxidant. It means the free radicals will take over and it will start eating and destroying every part of our bodies. And you could ask, where do I get those free radicals? What is the thing that my body will not be able to do if I have too much free radicals? Again, if we're in an ideal situation, your body does good work. It metabolizes your food, and then free radicals are produced as a normal waste product of your body. And then you have your natural antioxidants that are inside your body, and those will do the work to handle the free radicals. So you remain healthy. But that is not the case in reality, because your body will produce the free radicals, but again, you'll be exposed to toxins all around you. You'll breathe in toxin, you'll eat toxin in your body, you'll put toxins on your skin. All of those will be absorbed in your body. But you're also tired, you are ill, you are stressed, you take drugs. All of those, they add on to too much more toxins, more than the natural antioxidants that your body has. So your body will be overloaded, and those free radicals will have the free time of day to be able to destroy your body. So you will have that premature aging and even diseases that will start taking over in your body. So it's very important to think, what antioxidants am I using? Because in this day and age, you cannot live without antioxidants. You cannot ignore the importance of antioxidants in our health today, because more than 95% of all chronic diseases that we are afraid of today, even more than malaria or any other thing, is caused by our food choices, our toxic things that we put in our bodies, our nutritional deficiencies, and lack of exercises. So all these things, they're the biggest causes of challenges that we're facing today. So if we just focus on handling these 4 main issues, we'll get rid of a lot of challenges in our health. Because the food you eat, it could either be the most powerful form of medicine or the slowest form of poison. So ask yourself, what is your normal diet? What do you put in your bodies most of the time? It's not about 100% of your time, because we all indulge sometimes and eat something that we're not supposed to eat. But what is the most part of your diet? Because your body needs food. It doesn't need just a plate. It needs nutrition. It doesn't just need food to be able to heal itself. It needs the proper nutrition. So ask yourself, do you eat to be full, or you eat to satisfy your nutrition needs? Most of the time, we just eat to be satisfied so that we can go about our day, and we don't care about the nutrition that is there on our plate or in our foods or in our nutrition. But your body needs proper nutrition to heal. If we lack the nutrition to heal, it will not heal. The same way that my body healed after I gave it the right nutrition, anybody can heal. And one thing that we should know, We are all fed by an industry that pays no attention to health. So we should be careful what we put in our bodies, because the people who are making our food, they don't care about our health. They care that we buy the food, that it looks good, but they don't care about our health, the impact of the things that are put in that vegetable while it's growing, the things that are putting it to preserve it, to make it last longer, to make it look good when you see it in a supermarket. They don't care about that, but they care about you buying it. And again, when you go to the hospital, they don't care so much about your nutrition, because in the first place, doctors are not taught nutrition. That is something you need to teach yourself. You need to research yourself. You need to know in the background. So most doctors are not taught nutrition, but nutrition plays a big part in your healing. They'll just give you drugs and medicines to heal your body, but without knowing that you need proper nutrition to heal. They say when you eat well, medicine are of no need. But when you eat badly, it means the best medicine in the world will do you no good. So it's very important to know nutrition is the key for everything. And this doctor from Harvard University, I love this thing that he researched and found, that any balanced diet should include a dietary supplement. Because you cannot say I eat a very nice looking plate, but again, do you grow every vegetable that you eat? Most of us don't. So if you don't grow it yourself, you don't know if it's natural. You don't know if it's the nutrients are not lost in the process of manufacturing until it comes on your table. Most of the things that we eat, they could look good, but probably most of the nutrients are already gone before you even put that food on the plate. And that's why it's important to supplement. It's important to put a supplement as part of your diet. And that's why I'm extremely proud and grateful to introduce you to this company that has been my friend for over 10 years now, the Aloe Vera company, Forever Living Products. That main focus is health. The basis of this company is focusing on helping you look better, feel better, based on improving your nutrition and helping your body get the most from your food. But what I love about it is we are not just sharing products that are used in one country alone. No, we are internationally certified company. Quality is 100% approved. In our company, we say anything less than the best we'll never do. There's a lot of research that goes into making of our products, and that is why we have gotten all those international certifications of approval. Our products are certified by food and drug authorities of every among the 165 countries that we operate in. Each of all the 165 countries that we operate in. So one thing you can be assured of is quality. And again, another thing you can be assured of is the right nutrition for you and for your health challenges. So what do we have? I'll just go briefly and share with you some of the key supplements, some of the key things that I say every lady should think about using, not just think about, but should start using immediately. One of them is our bestseller, the yellow bottle that you see on this picture, the Aloe Vera Gel. We talked a lot about antioxidants, about free radicals and the damage that is causing in our bodies. So if you ask yourself, what antioxidants are you using? Aloe Vera Gel is one of the biggest ones that you could give your body. And one thing about this drink is it will not just be a source of antioxidant to cleanse your system, but it will help cleanse your digestive system as well. One of the biggest roots for diseases that happen in our bodies. It will clean your digestive system. It will help your body heal. It will boost your immune system. It will help your body get the right nutrition that you need. It's super loaded with nutrients that anyone who wants good health, it should start with the yellow bottle, the Aloe Vera Gel. And from there, we have a lot of variety. This other one we call berry nectar is another great one for women. If you're facing like recurrent UTIs, it has cranberry juice, which is very good for cleansing your uterus, your reproductive system, your skin. So it's a very good one for someone who wants to maintain a good health, especially for someone who has those issues in your reproductive system. We also have another one for ladies, a very good one for women, because especially elderly women, we face a lot of issues in our joints. They get weak, they get the joints, they start scrubbing on each other, and it's very painful to move. Because of that fluid that it disappears between one bone and another. So when you drink that, it naturally relieves your joints and it gives you that flexibility that we all need, no matter your age. So these are the drinks, the very first recommended products for you to drink this Aloe Vera Gel. This is something I drink every day, and it helps my skin glow. It makes me look younger for my age. When you're talking about anti-aging for women, this is also something that you should think about. Another very important supplement for women, and it's in form of a drink, it's Pomestine Power. I say every lady should not miss this in their fridge. Why? Because when you talk of antioxidants, they say fruits are not made the same because they vary in the way that they help your body cleanse, get rid of those free radicals. So this pomestine power, it has put together the top range of antioxidants. We call it an antioxidant bomb. It has the most concentrated antioxidants. The ones that are top are the way that they cleanse your body and get rid of the free radicals. So if you have any issue in your body, I could say any disease in your body, it means you need extra antioxidants. So choose this most potent antioxidant, the pomestine power, that will help your body get rid of those toxins, get rid of those free radicals that are causing premature aging and a lot of these non-communicable diseases. Anti-aging, this is one of the best anti-aging drinks you can drink also, but it's also very good for women because it has a lot of skin-loving nutrients, one of them being vitamin C, which is very good for your skin. It will make your skin look supple. It will look younger for you, even as you age, because your collagen will still be intact. We need a lot of vitamin C as ladies to continue looking good. But it's also great for immune system and a lot of other areas. And another big bonus is it tastes amazing. You can drink it as it is, or you can mix it with aloe vera gel and enjoy it. So that is another very important drink for you. But again, before we go even further, we should come back and remember that a lot of issues happening for women, they go around your weight, they go around your overweight and obesity, something that we should handle or be able to get rid of from the very beginning. So work on your weight. Look at your weight from the BMI perspective, not from the way you look, but what is the weight that you're supposed to be at from your height. Cleanse and detox often, because like our bodies are machines. We take our cars to servicing every now and then. When do you take a moment and take your body for servicing? You could be having a lot of issues, but when you take a moment back and cleanse your system, you can get rid of most of those challenges. So we have this program, it's called C9. It's a very powerful cleansing program. I'm actually on day 7 of my cleanse. It's the second time I'm doing this year, and I'm loving it so much. It's something that will energize your body to help you lose a bit of weight, and we call them the toxic weight. The toxins that we put in our bodies, you need to take a moment and remove them so that your body will go back to optimal functioning. But again, this is helping a lot of women get on track in their weight. We have a lot of people that have lost tremendous amount of weight because of these programs. Some of them after their pregnancy, you see this lady is a mom of 2, and another lady, Veronica, a mom of 2, looking like a 16-year-old because of this cleansing program. I myself was able to totally change my looks and my health because of these cleansing programs. And I'm choosing this lifestyle because cleansing is important when you want to improve your overall female health. But again, it will give you a lot of extra benefits when you cleanse your body. We see this person who had irregular periods. He didn't used to get periods, but when he did the C9, he was able to get the periods back. We have someone who was facing infertility, but then when he did the cleanse, her body naturally was able to conceive. So this was another testimony for someone who was able to conceive because of the doing the cleanse. So the cleanse will open the road for you to get your good health. But I will not miss talking about one of my favorite products, and it's a very special must-have supplement for women, Multi-Marker. Even if you don't have any of the challenges we talked about, this is a supplement you need. Why? Because it has tons of benefits for every age. For someone who is probably in the puberty period, they're facing a lot of hormonal imbalances, premenstrual syndrome, any issues like that, it will be able to give you a lot of benefit. For someone who is handling a lot of stress, anxiety, depression, this supplement will help you. Maca is a natural herb that is grown. It's like food for people who are living in the Peru region, and they use it just as normal food. So it's a supplement that helps them a lot, boost their fertility, improve their reproductive health. For people who have dryness, vaginal dryness, and lack of desire, lack of sexual desire, this is something that will tremendously change that very quickly because it's a very powerful supplement. It will also boost your energy and stamina just for even your normal works and your normal day-to-day activities. Even for someone who is around menopausal season, who is already after menopause, and you have hot flashes, you have all those issues that are happening, around the postmenopausal period. This is something that will help you tremendously to get rid of that hormonal imbalance and to help you feel good and enjoy your period. This is one of the 3 major supplements that I personally used when I was tackling PCOS as well, because maca is also known to be extremely powerful for someone who has PCOS, and it's a very important supplement for you. The very good thing about it is you can use with your husband. Both of you need it. Both of you will enjoy best when you use it together. And we have a lot of testimonies as well. People who had, this person had very regular periods. They used to go up to 8 days. After using Multimaca, those periods were regularized. This person, you see here, wrote a lot, had issues with fatigue, had stress, was not able to sleep well at night, did not have any desire for sex, and it was difficult for her. But after she started using, she was saying thank you to the person who sold the Multimaca too, because now all of those disappeared. He was able to sleep well, to get back the energy, and to be able to get that desire to enjoy their intercourse. So we have a lot of testimonies. This person had dryness, vaginal dryness, but then after using this product, he was able to get that fluidity and that ability to enjoy their intercourse even better. So we have a lot of testimonies of people who have used maca, and it has done tremendous changes in their health. That's why I recommend, don't miss Multimaca in the products that you're going to use. But another very vital product for women is Vitalize for Women. We talked a lot about vitamin D. This is something that is loaded in this product. We have a lot of vitamin C, D, E, vitamin B, folic acid, B12, calcium, iron, magnesium, which are all extremely vital for our women's health, extremely vital for hormonal balance, extremely vital for issues like premenstrual painful periods, premenstrual syndrome, all those issues. So it's a very important one to help your body get rid of those free radicals, help your body balance the hormones. Vitamin D is vital for hormone balance, and it will help you do that. It will help you reduce your issues of urinary tract infections, recurrent issues like that. Vitalize for Women is very powerful because it has cranberry also as one of the ingredients. Stress and anxiety, one of the biggest factor causing women not to enjoy sexual intercourse, to have a lot of hormonal imbalance issues, is stress. So this will help you get rid of stress, enjoy your healthy mood, support your detoxification, so that overall as a lady, you have total health. Even if you're in menopause, you're before menopause, you're 20 years old, you're 18 years old, this is a supplement for you. If you're a woman, this is a supplement for you. So that is another very must-have. And the third must-have for women is royal jelly. Why? Because royal jelly is a natural ingredient that is made by bees, and the bees use it as the single food, the only food for the queen bee. The queen bee can produce up to over 2,000 eggs per day, and that is the food that nutritionize their bodies to help them to do that. So it's very nutritious. It's very a premium product that is the bees make, and it's very good for your immune system, very good for your hormonal balance as well, to help you handle stress and balance your stress, to give you a natural boost of your energy and all that. And it's also very good for your brain, relaxing your brain. For someone who has even migraine headaches, this product helps them a lot. You have the headache that is associated with hormonal imbalances, this product will help you a lot. But again, what I love about it is it touches your egg health. For someone who has infertility probably, and they want to boost their fertility, this is a product you cannot miss in the products that you're using. Why? Because if you have irregular periods, you have probably too much period or too little period, it will help you balance that. If you don't have ovulation, this will help you naturally get ovulation. It will improve your egg health so that you're able to get fertility. I used these 3, Multimaca, Vitalize for Women, and Royal Jelly, and they changed my health tremendously. So these things, 3 products, I highly recommend you not to miss them. But we also have people who faced fibroids, the thing that I talked about, the tumors that could happen in your uterus. We have this lady called Rafia, who is now a mom of 2, but there was one day before she even became a mother, she was diagnosed with fibroids, and she was at risk of being removed her uterus. Why? Because he had 3 of them, and the doctor already scheduled her operation for about 4 months down the line. But she immediately met someone who was doing Forever, recommended to her the products, and she started using these products. These are the main supplements that we recommend for someone who has fibroids, because just a few months of using those supplements, those 3 fibroids, they changed into 1, because 2 of them dissolved And then the one who was 7 centimeter remained only 3 centimeter, because she gave her body the right nutrition, the right supplements to help her body heal. Now she's a mom of 2, her health has been restored, and she's helping a lot of other people do the same. So we have a lot of people who have been touched like this, who have had tumors. And I say this to say that not all will be dissolved only with supplementing. If you catch it early, that will be the best thing. But probably if it's too big or you really need an operation, you could still get the operation, but go to the root cause. Still use these supplements to help you get rid of any future occurrences. I think we'll go a bit beyond time. I apologize for that, and I hope you'll stay on board, but we are just about to finish. So stay online. Thank you so much. So among the products that are used for someone who has any tumor, any inflammation in your reproductive system, I would say don't miss this product. Forever Bee Propolis. It's one of the best products for women. If you have endometriosis, someone who has PID, like we talked about it, any tumors or cysts, this is something that you need. Why? Because it's very good for handling inflammation. It's a very powerful natural antibiotic. So any issues with infections, any issue that will predispose your body to infection, even for someone who has recurrent vaginal infections, every now and then you get those itching and the vaginal discharge and all that. Take your nutrition. On top of taking your drugs, from the doctors and all that, take your supplements, because they will go to your body, boost your immune system, help your body fight and get rid of those recurrent infections. So this is another vital supplement. I've seen it's something that also helps a lot with people who have endometriosis and it's causing them to be infertile. It will help even prevent that or reverse that challenge. Yeah, so it's another very vital supplement for women, but you cannot not talk about this one. Actic C, it's something that, like it shows there, it's a kitchen cupboard essential. It needs to be in your on your kitchen counter. Why? It's one of the most vital supplements, not just for women, for everyone in your family. And that's why it should be in your kitchen where everyone in your family will use it. But omega-3, we have seen them over and over again throughout our presentation. Why? They help from your hormonal balance. They will help preventing the vaginal dryness that we talked about. They will help reduce inflammations. Anything that will cause inflammation in your body, omega-3 is important to reduce it. For someone who has any tumor, cyst, or any inflammation in your body, in your reproductive system, you need omega-3. Omega-3 is also very good for joints. It's also very good for your skin, for your hair, for your eyes. And that is why it's something that you should not miss. For brain development, if you're pregnant, this is another something that you should not miss in your diet, because it will go to your baby and it will help with the brain development. Another supplement that is very vital for your kids is this omega-3. It will control your cholesterol level. Even if you're overweight and obese, it means you need to take extra care of your blood circulation. So omega-3 is the one that will get rid of the bad fats, and it will give your body the right fats that will help your blood system and every other system to work the way it's supposed to. So this is one must have for any lady who wants to maintain proper health and get rid of all those challenges that we've talked about. Yeah, so if in a nutshell, if I talk about anti-aging supplements, I say you should not miss the powerful antioxidants that we have. Like we said, one of the biggest causes of you to age faster than your years, is the free radical damage. So we need to put a lot of antioxidants in our bodies, from Aloe Vera Gel, Pomestine Power, RG+. Those 3 are very, very good anti-aging drinks. But also supplements are vital. Absorbent C, vitamin C is a vital supplement for your age, for preventing quicker aging. So you can get vitamin C from Absorbent C, Forever Daily, or Forever Kids, any of those. Royal Jelly is another very good one. It has the benefit of anti-aging as well, because the queen bee, because it's the only food that the queen bee eats, Royal Jelly, he can be able to live for years. But other bees, they die very quickly in a matter of months. So that is something that will help your body to go further than it naturally can. And also A beta care, because it has a lot of vitamin A, vitamin E, in form of vitamin A in form of beta carotene, and also a lot of antioxidants like selenium, which is very powerful to help your body get rid of those free radicals or fight those free radicals. So these are for anti-aging. But again, for someone on menopause, we say don't miss these, because these will handle most of the issues that we've talked about that are happening around the menopausal period. Vitalize for women, Royal Jelly Multi-Maca, the trio, the 3 very important supplements for women. But also Pomestine Power, Berry Nectar, it's very good one for someone facing menopause. We talk. I put there the Forever Light Ultra because people who have menopause, actually they lose a lot of protein. They need extra protein during that period. Yeah, so that's why it's important to add on that. And also Arctic Sea, but just not to overlook another very important one that is not in the picture here is calcium supplementation. I would say minerals. You need that a lot because as you age, your body does not produce, can no longer produce enough of those minerals, and that's why you need extra calcium to help keep your bones strong so that you don't have those breakage and painful bones and all that. So these are the vital ones for someone going through menopause. But so in a nutshell, what we've talked about is health is multi-dimensional. So it should start from healthier lifestyle. Make a choice to include exercises often in your lifestyle. 4 times a week is a very good number to go around. Drink a lot of water to help your body get rid of water-soluble toxins, but some of them are fat-soluble. So you need to go an extra mile to get rid of those by taking the right antioxidant, taking the right, cleansing your body with the right cleansers, and doing that 9-day cleanse. But again, you need to eat mostly healthy food. Like I said, we all eat some chocolates from time to time, but most of the time, make sure you're choosing healthy food. Cleanse and detox your body often, once or twice a year, because you do the same for your car. Why don't you love your body even more than you love your car? Because you don't even switch off your body, but your car, you can switch it off and take it on a break. Give it a little break. So if you have never done a cleanse this year, I would recommend don't let the year pass. I would even recommend don't let this month pass by. We have the C9 challenge that is actually on in Zambia. It's starting actually tomorrow. So you can get your C9 pack and get on board so that you get the right support around you to help you give that treat to your body, cleanse your body, and then you'll continue using the other supplements even from there. This is a very important part of your healthier you. So you should also work on your weight. Even after cleansing your body, continue until you get there to your ideal weight. Supplement with the right nutrients for you. Why? Because we're all in different situations in our health. So we all need the different nutrients depending on what our bodies need. Like all those challenges that I faced around that time, they needed me to use those 3 supplements. So probably you have a challenge, get the right supplements for you, get the right nutrition for you, because food is not enough. No matter how well you are eating, it will not be enough to give you the right nutrition that your body needs in this generation. But also give yourself me time, love yourself, take care of yourself, not just your body, but also your spirit, your mind. Align it well. Take time out so that you're able to renew your mind, refresh your mind, renew your spirit, so that your whole health will be restored, because it's not just about your body. Get rid of stress in any way that you can. You probably it's money stress, then get a way that you can supplement on that. Or probably it's a relationship stress, you can be able to get rid of that. And health stress, you have a way now to get rid of that and be able to enjoy your health even better. So your health, I'll conclude by saying, is not an expense. It's an investment. But if you don't take time to invest in your health today, there's a day your health will be a big expense. So take time today. Putting money on your health today will be an investment. Don't look at it as I'm wasting this money. No, I need my health 10 years from now. And what you do today will contribute to what your health will look like 5 years, 10 years from now. Every day matters. So start now. Choose to start where you are. Start where you are. Don't say, I cannot get all these things that we've talked about. Start where you are. Use what you have. Do what you can. Start with what you can. And we have a lot of ways. You can talk to someone who invited you to this meeting. We have a lot of ways for you to get these products. You can be able to get these products at a discount, 15% discount. If you choose to use more of these products, Forever will give you that opportunity that you can use more, even be able to share some with the people around you. Because I know from all the knowledge that you gain today, there's probably someone you know who you can share that with. Probably someone you know who is battling one of the challenges that we talked about. They say knowledge is only power when you share it. So don't stay quiet with this information. Find someone you can share this information with. You can probably invite them to the next meeting we have like this, so that you can be able to pass on what you have gotten from this talk. So my dears, I thank you so much for being attentive throughout this talk, and I believe you got some real value out of this presentation. If you have any extra question or thing that you want to clarify about, you can check me directly, Elizabeth Riwa. I'm on Instagram as well as at Betsy Salema, Betsy Salema, or you can contact anyone who invited you to this talk, and they can find a way to get to me if there's something that you need to ask from me directly. So thank you so much. I believe you have learned something of value, and I'll just check a bit if there's any question from the chats. I see people have enjoyed the presentation, very educative. Thank you. I don't see any question. So I will think we have finished the presentation. I'm so grateful for having you here throughout the presentation. Thank you for staying in. And like I said, go share this knowledge with someone else. Don't stay quiet with it, because God put you here for a reason. And I believe that reason is to share with someone else what you have learned here today. So I thank you so much for being here. And this will be the end of this presentation. Thank you so much. I wish you an amazing night and a very awesome weekend. Thank you.